business owners and executives from around the Valley. This is Business Leaders with Lance Cardoza.
Good morning, everybody, and thank you for watching Business Leaders. I'm Lance Cardoza. We'd like to thank our sponsor of Business Leaders, Flooring Liquidators. Make sure you check out Flooring Liquidators and Steve Richardson and the great team over there. On today's show, it's a great episode. I'm bringing friends on all the time talking about their businesses and talking about what they're doing here in the Central Valley. Darlene Primavera, thank you for being on my program. And you're Medicare Assistance Insurance Center. And
Yes.
you are a plan specialist.
Yes.
For insurance.
Absolutely.
And
Yes.
how I know you, and you know, and everybody that's watched my show, Business Leaders, know I'm very passionate about our veterans, and I love to find organizations that are very supportive of our veterans. And I met Darlene, and I already have met your husband in the past, and realized,
Yes.
oh, this is the great person they keep talking about. And you've helped many veterans with
Yes,
your
I have.
business.
Absolutely.
Tell us a little bit about your business, Medicare Assistance Insurance Center,
Yes.
and tell us about it.
So basically, I'm an independent agent for specializing in health benefits for Medicare, which consists of 65 and older and or Social Security disability permanently when it comes to a younger age. So what I do is Medicare covers 80%, and I help figure out and talk to the client in regards to their 20%. Which benefit are they going to be, which would fit their needs? And that's exactly what it comes down to. What is going to help them? Do they have a special needs, a chronic condition? Are they just perfectly healthy? So sitting down and spending time with them and putting them where they fit, and at the end of the day, it's up to the client, but that's what I specialize in, to put them in a plan that will benefit them and their household, because obviously there could be some type of expenses that incorporate in their
And
benefit
do you find
plans.
a lot of times it's maybe misinformation? They were told there was no opportunity beyond what they have currently, and you're able to navigate that for them better?
I am, and I always tell my clients, it's black and white. I can't make it up. So whatever the plan has signed on with CMS, that's exactly what it is.
Yeah.
You know, plans do change. Doctors do sign off on that certain plan and or groups. So if it worked for them in a short period of time and things have changed, we go back and we revisit it. And so where did the physician go to? Which group did they go to? And that's important when it comes to their plans and when they want to follow their physicians and or specialist.
And Darlene, you, when I saw you helping, I think it was AMVETS.
Yes.
You had a table.
Yes.
And you were meeting with a lot of the veterans.
Yes.
A lot of times you'll find in their programs that there is opportunities, and there's changes all the time, and we have new changes online, is what I've heard.
Yes.
And we thought perfect timing to have you come on the show and talk a little bit about that. That would benefit a veteran, and not only a veteran, anybody that would be looking for your assistance and plan specialist to be able to find out, am I on the right plan?
Correct.
And what additional could I get? Are you seeing those big changes? Are they happening now?
You know, they happen all the time, Lance. I mean, honestly, it just happens to be Medicare has AEP, which is annual enrollment period, which is going to be coming up October 15th through December 7th. Those are certain periods that you're in a plan that you can change during that time. But, you know, at the end of the day, Medicare has special enrollment periods, which, let's say you moved out of the area. And let's say that your husband and or spouse has lost their job due to COVID. They put you on COBRA. There's special different periods that enrollment periods that you're able to sign up. So it's not just what's coming up, which is AEP, but also during AEP, the plans come out with new benefits. So that's why it's important to stay in contact with your client, because obviously, one, you don't want to lose your client, because that's what you're there for. I mean, you're there to help them, because this is a lifetime major benefit for them, and then also because of cost again. you know, and making sure that they're where they should be.
Yeah, absolutely. And I think a lot of times you probably get questions from people that say, well, I don't want to mess with my plan because it might change my healthcare provider or my physical therapist, and that's why you do need to talk to a plan specialist like yourself at Medicare Assistance Insurance Center, because Darlene, you could reach out to Darlene and could help navigate that for them. So I think a lot of times people are afraid to change.
People are afraid to change, Lance. I mean, they really are. Some people are like, you know what, I've been fine where I've been, you know, and I don't want to change. Or you know what, there's some people that are already working with an agent, and I'm very, I tell them up front, if you're happy with your agent, call your agent. But these are also here because, again, I'm credentialed with 11 different plans for the state of California. Why? Because I deal with a lot with the AMVETs, and the AMVETs are from San Diego, Riverside, all the way to down north. Yeah. So I have a wide variety that I do help educate. And at the end of the day, Lance, it's all about education. Yeah. It's all about what you know. It's all about what you could help the client with.
And especially with changes that are happening, and you're staying abreast of those, and you can relay that information. And for those of you at home and you're wondering AMVETs, if you're not sure what AMVETs is, but AMVETs is a membership organization of veteran, either served either wartime or was a veteran at any moment in their life.
Correct.
Currently serving or a retired veteran.
Absolutely.
And as veterans said, you still continue to serve. You still serve your community, you serve your fellow veterans, and that's what AMVETS, Department of California, which we're both very passionate about.
Absolutely.
So that's just one segment of people that you're helping, but anybody with Medicare that would need assistance or knowing excuse me, if they're on the right plan or the right trajectory and with their medical plan. So we're going to take a short break, and when we come back, I want to talk more about that, but I also want to talk about, you have deep roots. Deep roots right here in the Valley, and I'd love to talk to business people. You probably haven't been in business many years with your company, but you've had deep roots for many years here in the Valley.
Yes.
So those of you watching here on Business Leaders, make sure you go to the site below at businessleaders.tv, or that little QR code. Just pull up your camera with your camera open, and you'll be able to scan it, go right to the website, and find out how you can get in contact with Darlene Primavera. We'll be right back with more Business Leaders here on KMPH Fox 26. Don't go away. More to come.
Business Leaders with Lance Cardoza.
Welcome back, everybody, to Business Leaders. Lance Cardoza sitting here with Darlene Primavera. Thank you for being on my program.
Thank you.
And we've met several times, like we were talking about in the top of the show, through other friends and relationships that I have, but it's all led back to veterans.
Yes.
It has, in support of veterans organizations, and that's how I found about your passion. Correct. As a Medicare Assistance Insurance Center, your company,
yes.
But you as a plan specialist. But we talked about you having real deep roots.
Yes.
Deep roots, family business, been here for many years here in the Valley, right?
My husband and his family have a family business. They manufacture frozen foods. And so, yes, I mean, it's been going 45 plus years.
Wow.
So.
And I say that because as a person doing business with others, you always want to make sure they're real good, they're personable, they're great, but are they going to be here tomorrow when I need them?
Correct.
Are they going to jump to another business or disappear on me? So I always want to look at their background, and you're deep rooted here in the Central Valley, and you're building a business of helping people, because I think that's something above everything you do as a business, you're helping people.
Correct.
And I was just talking to you, we had coffee yesterday, and you see that passion.
Yes.
Yeah, and I love to celebrate those wins of those people.
Thank you.
So having deep roots, that's a very important part. But during the break, we were also talking about what veterans currently serving, young veterans.
Correct.
There's sometimes dispelling the myths to have them understand, or like you said in the top segment, educating them. Mm-hmm. And what are you doing right now that you see out there?
So right now I see a lot of veterans that were not wounded during combat, mm-hmm. Which need help, and they feel that everything takes time a little bit. Paperwork takes time through the VA, and so and this is something that I've learned through an organization that I've been involved in for the last 3 years. It's called Calvin, and it's out of Tulare County, and it's Citizens Assisting Living Veterans in Need. So I'm a civilian, and there's a lot of veterans that, and civilians, we all come together, and there might be 30, sometimes 50 people around a big table. How can we assist these veterans? What can we do as different organizations, different businesses? How can we get them help? And so we understand that we all have, I have the Medicare 20%, the supplemental. I have that. We have EDD helping them get them jobs. We have people from the state welfare department. We have people from the homeless helping them find different types of housing. So we all come together, and at that time, we don't even really try to say, hey, well, I could do this, I could do. It's more like, where do they need help right now?
Yeah,
because it's right now.
Where's the
Absolutely.
need right now? And you can fulfill that need with a group of people.
Absolutely.
All like-minded, all passionate about it.
Correct. Yeah. And so that's when we all come together and say, what can we do? How can we help the people that served our country? How can we serve them? Yeah. And it's a blessing, and it's wonderful, and you leave there like, oh my goodness, you know. Yeah. I've had phone calls, we've had emails saying, hey, we have a family that needs help. During the pandemic, there's a lot of people that lost their jobs. There was Christmas, there was Thanksgiving. What can we do? And just from the business background, from the deep roots of from where we're at, we could make a call and say, hey, what do you have? What can we take this family? Because obviously the parent, the veteran is like, gosh, you know, I went out and I did this for my country. Like, I can't even help my kids right now. What can we do? I mean, we've had different companies say, hey, we'll give them presents. Hey, I've had food banks come and pick up food for these. I've had another company that, or another organization that I've been with and said, here is a check. Give this to the family. But again, it's the community coming together to help the veterans.
And I think also too is you'll see that even if you're at home and you're not a veteran, you're very passionate about helping somebody when they come to the table. Just like Calvin, and they all come together, like-minded people interested in this to help veterans and young veterans and everybody in between. That that carries over in everything you do.
Absolutely.
With taking care of your client, and a lot of times that same passion becomes a passion once you hear their story and you know their position, and you seem like that person's going to figure it out.
Yeah.
There's a way to figure it out, and a lot of times people sometimes get in the no hope. Because someone told them it can't happen, and a lot of times, sometimes there's dispelling the myth of the truth, and find out where that truth is to help them out.
Correct.
And it's education, like you said, and again, we talked about that at the top of the show. If you want to find out more information, and with Medicare, and like you said, that 20%, and maybe there's more options for you, or you're stuck in a rut and you need to talk to a specialist. Go to businessleaders.tv, and again, you can take your phone and you can scan it right on the QR code, and then you can go to the website. We'll get you connected, and then you'll be able to talk to a plan specialist like Darlene Primavera.
Yes.
And I can tell you're passionate about it. You're busy all the time, and you're constantly meeting with somebody and helping them out with their plan. And there's a lot of people that need that help, and especially, like you said, coming out of a pandemic. When we come back, I want to talk about maybe something that a young person is at home and is thinking about starting a business or jumping out there. And you got to be passionate, or you're stuck in that job, or you're trying to figure out what you want to do. And you want to find something like what Darlene has done. And Darlene created a business for yourself, and you're accountable to yourself, and you got to hustle to make it happen, but you're passionate about it. We want to talk to a young mind or person that's thinking about changing it when we come back right here on Business Leaders. Don't go away. More to come right here from the studios at KMPH Fox 26 with Business Leaders.
Business Leaders with Lance Cardoza.
Welcome back, everybody, and thank you for staying with us here on Business Leaders. I'm here with Darlene Primavera, and every Tuesday morning, 11 o'clock, we have Business Leaders, and I love bringing our business leaders from the Valley on the program here at KMPH Fox 26. And Medicare Assistance Insurance Center is Darlene's company, and you assist anybody that is in a Medicare insurance plan. Do anything beyond Medicare, or is it focused on that? You're specialized in Medicare assistance?
So, I mean, besides being with different programs, besides, I mean, if somebody calls me, I help them as well apply for Medicare, because especially right now, you know, Social Security Administration is so backed up. You know, I said, hey, as long as you have a phone, as long as you have your email, it'll take me only 15 minutes to sit there and help you answer these questions, and it gets the ball rolling for them. That's been happening more so lately, especially during the pandemic.
A lot of times they're frustrated and they're waiting, and you're a number, and it sometimes takes forever.
Well, they
but
can't
you
even
can
get
help push that through.
Yes,
Well,
absolutely.
they can't go physically.
Yeah, well, because they can't go physically.
Yeah.
So, you know, there's a penalty if you don't apply for Medicare during the time that you're supposed to. You actually have 7 months. You have 90 days before you turn 65, your birth month, and then you have 90 days after. Well, you could get up to 10% penalty every single month for the rest of your life that you are on Medicare. So they're afraid. They're like, oh my gosh, I'm going to get a penalty. I'm going to have to pay this. And so it just, you know, makes them more at ease. This is what I do. It's only going to take me 15 minutes. So why not help them?
And maybe as they're getting to that age, knowing it's coming, it's probably good to talk to you early.
100%. Honestly, at least a year to 6 months, because people, I'm learning now, are working until they're 68, 70 years old. Why? To help cover their insurance for their medical. They're so used to working, they're afraid, wait, once I retire, what's going to happen? Where am I going to be at? But it's so important to learn ahead of time. Can't say you're going to sign up, but get educated. Education's free. My services are free, and I don't charge for my services. And so you can never know enough in regards to your Medicare benefits.
And if you're watching at home and you're wondering, how do I get in touch with Darlene? You go to the website below, businessleaders.tv. We'll have the information there, and you can get a hold of Darlene and set up that no consultation charge.
Absolutely.
To be able to just see what you can do. And again, if it's coming to where your Medicare age is coming up to where you can qualify and get the paperwork, start early.
Absolutely.
Start early, ask questions. Education is key.
Absolutely.
And again, if you're somebody else too, that you can need to help someone else to get enrolled and navigate, or make sure you're doing everything right, you want to talk to someone like yourself.
Yeah, but when you turn 65, I mean, when Medicare hits, I mean, you're going to get bombarded with so much. Again, you're even like, oh my gosh, I'm turning 65.
Yeah. I'm 50 and I get my mailbox is full of everything. It's like burial insurance. It's like I get hit with everything.
Right?
Well, I think we all do.
So
it's a
going,
sad reminder.
Oh, 100%. So Lance, going back to just Medicare, I mean, also, again, I do a lot for the community. I also do life insurance. But, you know, I feel that right now, just again with the pandemic, knowing if you're covered with this whole COVID, knowing what's going to happen if I do get it, what's going to happen if I go in the hospital, those are really important. Knowing that you've been...
Those are true concerns.
Absolutely.
True concerns they should be worried about.
Absolutely.
You know, and be prepared.
For sure. Knowing the fact that, am I going to need that next booster? How do I get it? Like, oh my goodness. You know, I mean, we see all these commercials. We know that this is real stuff happening right now. And that also causes a fear. That also causes some clients to get this PTSD. And knowing that they have a company, a medical benefit plan that they could call and say, hey, they have nurses available 24/7, knowing that they have that peace of mind. It's truly a peace of mind.
Yeah, and you're helping them navigate that to get to that peace of mind.
Absolutely.
Before the break, we were talking with Darlene about if you're a young person at home, or you're a retired correctional officer, or a retired nurse, Yeah, and you're trying to figure out what's the next step in my life, or during the pandemic, it sort of turned your life upside down and you're looking for something different. What would you do if you were talking to that person, those two people, a young mind or a person that's trying to figure out what's the next step in their life? You started a business. What would be your advice?
You know, my advice was, it came to me. I, at 16, was an EMT. I worked in the operating room and assisted in surgery. Loved it, my passion. But you know what? That put me where I am today. It put me to know the knowledge on, okay, well, what's the chronic need that this client has? Like, what plan do I put them in? Medication, help them know where if they're blood pressure, diabetic. There's plans for that. Mental illness plans. There's mental illness plans as well. Mm-hmm. So having that knowledge and that background was key for me, and I went just like that, just like that. Helping educate, the physician's there for the patient, helping educate the staff. Mm-hmm. Why? Because the physician's going to ask the staff, hey, I have this patient that's on a diabetic plan, but they're not getting diabetic supplies paid for. What can we do? Simple. Those are the things that help and that you should know. But going back to call me.
Pick up the phone, and that number will be, if you go to the website below at businessstreet.tv, you can get in contact with Darlene and she'll be able to help you out. Thank you for being on my program.
Thank you.
That's all the time we have. Make sure you join us next Tuesday at 11 a.m. for another episode of Business Leaders.